Hello, my wonderful TM joiners. I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you about tooth pain and how it can be related to TMJ disorders. So how on earth could a TMJ issue cause tooth pain? Who do you see about this? By the end of this video, you should have the answers to those questions and more. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button and the little bell notification right next to it to get notified about when my next videos come out. I post a new informational video every Friday for people who are suffering from TMJ disorders or for people who are kind of just looking for more answers. Be sure to check out my TikTok and my other social media. I like to post tips, trivia, quick, efficient things that you can do for yourself that can temporarily help you feel better. So please be sure to check those out. The links are below. For those of you who don't know me, I'm a general dentist with a practice in Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So let's get right into it. Every other week or so at my TMJD only practice, I see a patient who has moderate to severe tooth pain. Oftentimes, this individual has had one tooth or several teeth examined thoroughly by their general dentist, their root canal specialist, and even an oral surgeon. Sometimes they've been to multiple root canal specialists because they are so convinced that the pain is coming from a very specific tooth. Some of these patients have even had root canals or multiple teeth extracted, only to find out that the pain is still there. This is a less than ideal outcome, obviously. So by the time these individuals make it to my office, they are desperately looking for answers. At my office, we do a very thorough muscle and joint palpation exam to determine if there are dysfunctional muscles or other structures contributing to pain. Oftentimes during this exam, we find that there are in fact some muscles, tendons, and ligaments that are very hot. And by hot, I mean that they are tender or painful to palpation. This means that if I apply 3 to 5 pounds of pressure to these areas, it triggers a painful or a tender response, and then the patient rates that on a scale of 1 to 3, with 1 being a little tender and 3 being painful. In an ideal situation, I should be able to put 3 to 5 pounds of pressure on all the muscles, tendons, and ligaments of the head, neck, and jaw that we examine thoroughly, that we palpate thoroughly. I should be able to put 3 to 5 pounds of pressure on them without the patient or the individual feeling pain or tenderness. If the muscle, tendon, or ligament that I'm palpating is tender or painful to this palpation, then there's a pretty good chance that it's in a dysfunctional state. When these structures of the head, neck, and jaw are in a dysfunctional state, it can wreak havoc. It can lead to headaches, neck pain, ear pain, eye pain, and yes, my friends, even specific tooth pain. Ding, ding, ding. The most common muscles that refer pain to teeth when they're in a dysfunctional state include the lateral pterygoid muscle, which I like to call the troublemaker, the masseter muscle, and the temporalis muscle. The stylomandibular ligament and the temporal tendon are 2 other structures that can also refer pain to teeth. To sum it all up, when these muscles and structures are angry, edematous, in a dysfunctional state, they can refer pain to teeth. So what can be done about this? Well, at my office, we treat with custom orthotics that put the jaw and the muscles and the structures of the head, neck, and jaw in their most relaxed position. We follow this up with myofascial release, and we typically see the tooth pain go down drastically or completely go away, usually within a month. So what is myofascial release, you may be asking? If you're wondering what myofascial release is, if you're wondering what an orthotic is, please check out these 2 videos. One is called What is Myofascial Release? The other one is Dental Night Guard versus TMJ Orthotic, and I've linked them both above. So that's really it, my friends. If you like what you heard or you learned something new, click like below, subscribe to my channel, do all the things. Questions and comments are always welcome. I try to get back to everybody. I'd love to hear from you and let me know if you've had tooth pain or you've been to multiple healthcare practitioners with really no answers. And remember, my friends, you can never have TMI about TMJ. Thank you.